Hello, I'm Allison Nunez, a graduate student at the University of Texas at Arlington with the College of Nursing in the Spring 2024 cohort of Management of Nursing Operations. Thank you for joining me today as I present my strategic and marketing plan proposal for the development of a nurse leadership development program for the County of Los Angeles Department of Health Services Health System. The Los Angeles County Department of Health Services is an integrated health system that includes 4 acute care hospitals and 26 outpatient health centers. It is the second largest health system in the nation that provides care to 750,000 patients each year and employs approximately 7,000 frontline nurses. Los Angeles County Department of Health Services' mission is to establish superior services through interdepartmental and cross-sector collaboration that measurably improves the quality of life for the people and communities of Los Angeles County. Los Angeles County Department of Health Services' vision includes a value-driven culture characterized by extraordinary employee commitment to enriching lives through effective and caring service and empowering people through knowledge and information. The Los Angeles County Department of Health Services values include compassion, innovation, excellence, welcoming, accountability, and inclusivity. The organization's focus is to provide services along a continuum of care to meet a full range of healthcare needs. The healthcare industry is expecting that nurse leadership turnover will affect 67,000 nurse leadership roles. Moreover, the average cost to replace a nurse manager is estimated at 75% to 125% of their departing salary. Nurse leadership competencies should be developed and used to facilitate the growth and skill mastery of how to perform in their role and interact with others. An environmental survey resulted in a lack of standardization development training program, which leads to nurse managers feeling inadequately prepared to function efficiently and effectively in their role. An internal survey was conducted among a randomized sample of nurse managers at Los Angeles County Department of Health Services, and 85% of nurse managers reported high stress levels and feelings of incompetency toward the skills needed to perform their essential job functions. With Los Angeles County's Department of Health Services' current state, the training and orientation of nurse managers are left with educational gaps that presents improvement opportunities. The goal of the program is to have a structured, standardized nurse leadership development program that will consistently be utilized at all Department of Health Services facilities. This will assist with ensuring all nurse managers are properly oriented to equip them with the knowledge and skills needed to perform their roles at an optimal level. Nurse managers are key stakeholders and are in a position that directly affects costs, quality outcomes, and financial reimbursement. For sustainability of an organization, facilities should recognize the nurse manager's impact on performance and the importance of the development of their nurse leaders. A comprehensive orientation program that is designed specifically for nurse managers aims to equip new and transitioning nurse managers with the necessary skills, knowledge, and attitudes required to excel in their leadership roles within their healthcare settings. The proposal for this program is designed to educate nurse managers in regards to leadership management, budgetary management, soft skills, and knowledge that is necessary for their roles. Activities to support this program include workshops, mentorship programs, leadership training modules, and hands-on management experience. This slide maps out the strategic plan for the Nurse Leadership Development Program over the next 3 years. The beginning phases involves evaluating the organization's current state, garnering support starting from the chief levels of the systems, data gathering, and best practices assessment. Product development is where the organization will develop the program steering committee, which consists of key stakeholders, to develop goals and define the program's vision. For a safety net system as big as the Department of Health Services, this objective may occupy the entire year. The goal for year 2 is to develop a selected work group from the steering committee to address specific goals that were identified. The planning phase is to lead and strategize by the work group where current evidence-based practices and industry standards are considered. The goal of year 3 is that once the curriculum and checklists are finalized, the cadence of the leadership development program is developed for dissemination. When looking at competitive markets with similar programs, surrounding area hospitals and educational institutions have similar offerings in training, mentorship, and didactic courses specializing in healthcare leadership development. For example, facilities with reputable standing, such as the University of California, San Diego, and Cedars-Sinai Medical Center, currently have a nurse manager leadership training program designed to develop nurse managers with an emphasis in transformational leadership who are working in a magnet designated facility. As a not for profit organization, the Department of Health Services receives income from both federally funded programs and certain commercial insurance for programs. The Nurse Manager Orientation program primarily involves Department of Health Services investing in the growth and development of the nurse managers. Investing in the program means investing in improved patient care, better staff management, and ultimately cost savings through efficient management. Some proposed marketing strategies include promotional activities, such as presentations at nursing and healthcare leadership conferences, collaboration with nursing schools and associations for direct promotion to their members, and local organizational presentations that will market the program to both existing and prospective nurse managers. Marketing and promotional activities such as network boothing during professional conferences generally averages around $3,000 to $4,000 in costs, and marketing advertisements are also an effective strategy in communicating Department of Health Services organizational reputation and goal in developing nurse leaders. Marketing advertisements in nurse organizational magazines such as The Working Nurse averages a cost of around $1,500. Promotional activities such as presentations at nursing and healthcare leadership conferences. Here's an estimated projected volume of the program, where you can see the nurse manager turnover rate decreasing over a period of the next 3 years as a result of the implementation of the leadership program. As a result, the organization increases their savings in the cost of nurse manager attrition, and also quality performance metrics improve as transformational nurse leaders are equipped with the knowledge to lead goal-driven teams. When this program proves itself successful, the development of a standardized comprehensive nurse leadership curriculum will build up the reputation of both the nursing department and the organization that prioritizes the development of its leaders. With the implementation of this program, leaders will have the knowledge and skills to function as highly developed, transformational nurse leaders, thereby feeling well prepared for the nurse manager role. The program will decrease nursing turnover from both frontline and leadership, thereby cutting recruitment and onboarding costs. Moreover, well-prepared nurse managers have the ability to lead their teams in meeting organizational key performance indicators, leading to financial surplus. Thank you.